Morning. Before we get started with this interview, I am going to let you know that we are allowed to do this maskless as per APH guidelines. The APH guideline reads, film and TV production sets must be set up to allow every person to maintain physical distancing except when necessary for filming of the film or TV production. In this case, Chief Hugh Stevenson is 6 feet away from me, even though it may not look that way on camera. We measured it out this morning. Thank you for joining me today, Chief.
Thanks for having me.
This is another segment in our series on mental health and addictions and homelessness in Sault Ste. Marie. And everybody goes back to, and when I'm in different groups and talking to different people, they all go back to the police play a big role in this in a certain way. Why don't we explain a bit about what your role is when it comes to homelessness, mental health, and addictions?
Sure. I mean, that's a big catchment issue. Specifically with addictions, Northern Ontario and North America have been impacted by long-term drug addiction through opioids. We all know that. It's been here probably a good 7 to 8 years. And police services and communities across Northern Ontario specifically struggle with it more, simply because it becomes more obvious in medium-sized urban centers where people gather for services. So what's the Sault Ste. Marie Service response to long-term drug addiction? We're strong supporters of prevention, that public education and awareness at all levels, whether it's your employer, whether it's your family, whether it's your social network, everyone should be aware of what their neighbor, their friend, their brother, their mother is doing when it comes to drug usage. And you should be looking for signs of addiction. You should be looking for changes in behavior. And the reason I say that is that if we can catch people and get them treatment and get them supports before they get addicted, then we save the community, the family, long-term harm. More importantly, we save lives by doing that. So as we know, cannabis was legalized a year and a half ago. The service, we do not prosecute and charge people for possession type offenses. We do for drug trafficking, if that's trafficking for the purpose or actually trafficking. So in those cases, we'll give them the full breadth of the law and they will be put before the courts. So
we're going to go on to, so somebody calls 911 and they're having a mental health crisis, or and we'll go with a mental health crisis at this moment. What steps, what does that trigger inside the police department?
Well, the first thing you'll be asked on a 911 call with the SERB operators, are you okay? Do you need the police? Are you in crisis? What's your situation? And that will dictate the type of response. If a third party is phoning about someone in crisis in the middle of the street or in their home, we will definitely send a priority 1 call there, simply because we want to make sure everything's okay. So really, the amount of seriousness that comes across on the call will dictate our response. But if a person is in crisis, call 911 and we will make sure that ourselves and other emergency services get there appropriately and make the situation safe.
So we have a crisis unit now. That was something that was referred to when we were talking with both the MPP and Lisa Case, and she said the police have this crisis unit with some specially trained individuals. Can you give me a little more information on what that crisis unit does and what it's trained to do?
Sure. The Mobile Crisis Rapid Response Teams was created, I believe, in 2017, originally started before I got here. And the results of it were incredible in terms of what we can do to meet the needs of people who are in mental health crisis. So we currently have now 4 trained frontline police officers in mental health crisis. We also have more than 4 social workers and nurses that ride around on basically days and afternoon shifts. Any type of crisis call that comes across the calls for service, they will be immediately dispatched to it. They're trained in, our officers are certainly trained in de-escalation, understanding what mental health looks like, trying to understand what type of drug they're on, ensuring they get safety immediately, whether that's through EMS or ourselves through Narcan. And so all of those issues basically make a much more safer community. You know, there's a lot of talk and speculation about, well, should the police be dispatched to mental health calls? And the reality is maybe not all of them, but when we have this combo unit, if you want to refer to it, where we have both the social worker and the officer that are both trained in it, both understand how to de-escalate the situation, and even if we have to take them to the hospital, the information that gets to the doctor comes from a mental health professional. So it's a wonderful program, and I can tell you we will continue to expand that as resources become available.
And on de-escalation, you aren't just trained to de-escalate, and I'm going to get a little bit off of this here, but you're not just trained to de-escalate mental health situations. De-escalation is key for all police situations,
That's correct?
Yeah. And I just wanted to make sure that people out there were aware that this doesn't happen just for mental health. They get called to any call, and their first step is to try and de-escalate.
Right.
It's part of that wheel that we all learned.
And de-escalation started, I'm going to say, at least 10 to 12 years ago, where all police training, whether it was senior executive training, middle management, or frontline, were trained on the issue of de-escalation. And that was due to a number of scenarios in Central Ontario where things went the other way. So
out in the community, everybody's saying, well, these individuals are stealing the mental health and addictions and everything else, and C75 isn't helping the situation. I had one person tell me, and this is from another police service, we can't lock them up, which makes it a little more difficult. How is C75 either making this better? Is it making it worse? Is it just not really a factor in the ongoing situation in Sault Ste. Marie?
Well, the C75 came along at the same time as long-term drug addiction did, as homelessness numbers, and it doesn't help things to a degree. It comes out of the Supreme Court of Canada decision called R versus Antic, and what it is, it's a ladder effect where the more times you're involved with the police, the greater chances you're going to be held. 15 years ago, there was more of a presumption that you would be held for bail. Today, there's more of a presumption that you be released, and only if there's evidence to indicate further criminal behavior will you be held. I'm very confident that our frontline officers are exercising Bill C-75 as it was intended. In fact, we hear back from the courts and the Crown Attorney, you're doing everything you're supposed to be doing with this. However, when you look at the number of people that are on long-term releases with multiple charges, it causes concern. Maybe in the old world, pre-C-75, those people would be held for bail. Today, there may be more of an emphasis to release them. However, it is only one issue in the big pot of issues that we deal with. And that's about it.
And I think that's going to help, because everybody goes, well, it's C-75 is causing them to be released. There's a whole lot of other issues out there. Like you said, it's just one part of a bigger cog, bigger wheel, right? So,
and even within release, every release is tailored to the individual situation. So you can't say, well, the call was this, and how come they're here? The reality is you need experts to go in and look at what is the issue of risk here. And the courts, the Crown Attorneys, the Defense Counsel all play a role in that.
Do you have a percentage for how many of your calls in a year? I know the hack may have made this a little difficult, but do you have a percentage for how many of your calls this year are related to mental health addictions, give or take?
We've had, in total mental health calls, we've had approximately 3,000 this year. The actual mental health calls where the person is suffering from a mental disorder has remained relatively consistent, but the personal well-being calls that get lumped into that has been up by about a third. Now that has a lot to do with community anxiety. It has a lot to do with COVID. I mean, COVID has affected people in many ways, right? Where they're concerned for their family members. We go on wellness checks to check on the elderly, check on people that just haven't been seen lately. So they're up about a third.
So if there was anything else, when we know we have parents, we have probably people that are addicted that are watching this with us as we're recording it, what would you want to say to them?
In relation to?
In relation to mental health and getting help or calling for help or anything to that effect?
It's similar to my introductory comments. The reality is the Sioux is one big family, and we're all much more connected here than we are probably most communities in Ontario. And that serves us well by making sure that we connect to and we're aware of what's going on with our friends, our family, our cousins, our neighbors. You know, I know it sounds minimal in terms of prevention, but who has the most opportunity to observe you is your family members. And if you see that family member acting differently, acting strangely, have the conversation, have the discussion about drug usage, have the discussion about mental health, have the discussion about when they've seen mental health professionals. And you can save lives by doing this. You can start the process so that people can be saved before they go down this pathway of, you know, homelessness, long-term drug addiction, and they're not all related, by the way. Homelessness is much different than long-term drug addiction and opioid use. But the reality is, I think, as a community and as family and friends, we need to be aware of and get people the help they need at the time, and don't let it wait.
Thank you for joining me today, Chief.
You're welcome. Thanks for having me.